Welcome to Pass Your Oral Exams. I'm your host, Tony Lloyd. I'm a licensed clinical drug and alcohol counselor as well as a certified clinical supervisor. Let's get right into the process. We're always focused on the client. Before your oral exams, what you would need to submit would be your case presentation. The oral exams takes the information from your case presentation as well as your entire experience and maps that experience with the client onto the 12 core functions. And that mastering that, practicing that is how you're going to pass your oral exams. First, you explain your screening process with your clients that you completed your case presentation on. And your screening process, as you know, is to identify whether or not your client is a good match for your agency. How would you know if your client is a good match? You'd have to look at the agency that you're working with. So, for example, I'm working in an outpatient setting. My clients have usually come to us already detoxed from substances and they need a structured program to help them maintain their sobriety as well as to help them learn more about their disorder that they are coping with so that they can leave with the skills as well as the resources to maintain their sobriety. And so in an outpatient setting, I would be screening to ensure that the patient has the best chance of maintaining their sobriety. If the patient is not a good match, I would then recommend a referral and sometimes have a discussion or a consultation with my team to share why I think the client is really not going to benefit from our services. And that's what you're going to present in your screening. And I would suggest writing the entire process out from screening. Next, we get into the second step, the intake. Once you've identified that your client is a good fit for your agency, you will then complete your intake paperwork. Every agency has a different process for their intake paperwork. We'll then orient the client to the agency. This includes the culture of the agency, the expectations of the agency, as well as the client's rights to complain on the agency if they were not satisfied. And all of this information is presented to the client. This information for the orientation may also include the schedule, the days and times when the client is expected to show. If your client was referred to the agency from legal sources, anywhere from the Child Protective Services to the federal um, federal probation officers or pretrial officers, or recovery courts, formerly known as drug courts, you will have to report in some form, whether it's weekly or monthly. You will have to provide reports on these clients to their officers. And of course, this information would be shared with your client on what you would be reporting on a weekly basis so that everyone is on the same page. Okay, so let's get into step number 4, the assessments. The assessments includes your NG-SAMs, completion of the everything, including DSM-5 assessments, including the ASI, Addiction Severity Index assessments, including your LOCI level of care, right? All of these assessments are completed. You may have to duplicate your efforts, so to say, because after completing your energy exams, which, once you get a experience started, it should take about an hour to complete. The process also involves the agency forms and applications and assessments that are required on an agency level. Okay, as well as uploading the relevant forms from the energy exams to your agency's portal. That being said, once you have a really good understanding of your clients, their needs, they've shared, perhaps how many times they've been in treatment, they've perhaps disclosed their their pre-existing conditions, whether it's physical or mental health, they've shared their legal needs, you're then in a really good position to help develop, co-develop a treatment plan. Typically, we're trying to help the clients work through three core areas. One of the areas, if they're involved in legal cases, would be to remain free from any further legal difficulties. That may be one of the goals. As they're coming in for substance treatment, it would also be to commit to learning more about the disorder and participating in the required levels of care. Also, if your client is perhaps in need of housing, that might be a case management resource. The client may say, I would like to have housing over the next 9 months. The client may also have employment goals. I would like to attain employment, within the next 3 months. Then we get into the counseling piece. Your first session with your clients, and you're going to be walking us through in your oral presentation. During my first session, I oriented my clients to the modalities that I use. So in my case, I use cognitive behavioral therapy. I would explain what that means to my client. I would also explain that I blend that approach with motivational interviewing, and I explain what that is. I would ask the client if that sounds something they would like us to partner on, and they'd usually respond, yes, that sounds great to me. We would then identify the goals that we'd be working on for each session. With CBT, we tend to have an agenda. Of course, the client's needs are always to the top of that agenda, followed by emotional processing, orienting the client to sharing, feeling safe enough to share their emotions. And we are describing that counseling process from the first session all the way to the last session. For my case presentation, I had 8 sessions. It's CBT. So I had 8 sessions, and the client successfully completed their course of treatment in the 8 sessions. I explained what we did from session one. I explained any, crisis or anything we had to resolve within that 8 session period, as well as how we prepared. We were prepared for the discharge of the client by even before session 8. So discharge is usually the discharge plan is something we prepare the client for from the very first session, right? So we're on the same page together. Next, we are going to discuss case management efforts. So again, if your client had some type of legal case, you're going to share how frequently you liaised with the officers, any concerns the officers presented about the clients, and how these concerns were resolved as a team. The client is a crucial member of the team, whether it's a client who's bound legally, or a client who's just walking off the street into your agency seeking treatment. All right. Next, we get into the crisis intervention. So sometimes we have emotional crises. Sometimes we have, uh, you know, the client perhaps getting into further legal trouble. Perhaps they gave what is called a positive UDS screen, and they were distressed because they were afraid that they were going to go to jail, or they're going to lose their children or their rights. And we are then quickly helping the client to evaluate the situation, to be as honest as possible, as upfront as possible with their officers. And many times it's helping the client to build healthy relationships and healthy boundaries, right? And then they recognize that the crisis is resolved because they have the resources. They have a lot more resources than they do threats by the situation. Once the crisis has been resolved, we also participate in educating the client. A lot of times clients may not be aware of all of the resources available. For example, if they're clients with children, they may not be aware that in New Jersey there are programs such as programs for parents to help clients with children from 0 to 8 years old with childcare, with exposure to other workshops and trainings. Right, so clients education is an important part of the 12 functions of a counselor, particularly a drug and alcohol counselor. Next, we have client referrals. Right, so we have referrals to places like reentry for our clients who have um, legal cases, and re-entry helps our clients with jobs, as well as helping them to expunge cases on their behalf, all free of charge, right? So they just have to show up with, of course, the right attitude and the determination. Takes a lot of determination, and preparing our clients mentally to have the resilience to overcome all of the challenges that they will face in their recovery journey. Of course, record keeping is a major part of the work that we do. Why? Our work could be subpoenaed by a judge. They would like to review our notes, they would like to review our process, our treatment plans. Okay, so keeping records, a lot of agencies no longer keep paper records. They may just have a HIPAA, um, a HIPAA monitored electronic system, and that's where we're going to describe that our clients' documentation was safely kept in the company's electronic system that was HIPAA approved. Finally, we get into consulting with other professionals. Each core function builds on the other core functions. I would like to say about the consulting process, we could be consulting throughout, particularly if we are CADCs and we are being supervised by others. The consultations could be within your team. So some agencies are so large that they have team meetings where they present cases, and people are able to give their feedback, clinicians are able to give their feedback. And sometimes you may have someone outside of your agency who perhaps is a mentor, right? So you'd have to explain to your clients, that you are under supervision and your Consultation may involve getting feedback from other professionals within the field. Of course, you're not disclosing their specifics of their case, but you might have to present a question about what to do in such, summarized cases. Okay, and that brings us to the end of how to pass your orals. You are going to detail the steps you took with your client that you presented in your case conceptualization and walk the person, you are speaking into tape recording. So you're going to clearly speak very clearly, take your time, and walk the examiner through the first to the 12th core function that you took with your clients. Okay, so again, I'm your presenter. I'm a certified clinical supervisor in New Jersey, as well as a licensed drug and alcohol counselor, all in New Jersey. I passed the oral exam with 100%, and what I shared today was exactly what I did. Okay, thanks for watching. Feel free to contact us by going to www.rlrgresilientstars.com. If you liked this video, it was helpful, you want to help others, particularly persons who are preparing for their oral exams in New Jersey, please feel free to like and share this video. Thank you and bye for now.